count on.
New Ebola protocols for healthcare workers are being crafted by the Centers for Disease Control today. This after 2 nurses in Dallas contracted the virus while caring for a man shortly before he died.
KOAT Action 7 News reporter Matt Howerton joins us live from the New Mexico Hospital Association.
Yeah, Shelley, after those nurses got Ebola, nurses across the nation started raising concerns about how current protocols put them at great risk if they were to care for a patient with Ebola. In Dallas, some nurses came forward saying their protective gear left their necks exposed. Today, new Ebola guidelines are being written by the CDC. They will require all healthcare workers to be completely covered up when treating Ebola patients. The CDC is also requiring healthcare workers to be monitored while wearing and removing protective gear. The New Mexico Hospital Association was briefed on the new guidelines this morning. Our state isn't at great risk when it comes to Ebola, but the NMHA says they'd like to be ahead of the game.
There has been an element of folks relooking at their protocols and working with the Department of Health to update them and make sure that we're as current as possible.
The president of the NMHA says he's been nothing but proud when it comes to the way hospitals across the state have handled Ebola preps.
Matt, what's the biggest fear the NMHA has? Are they telling you?
Yeah, Shelley, well, since Ebola symptoms are so similar to flu-like symptoms, they want hospitals across the state to be on their guard at all times. It's very difficult to interpret both in their early stages. That's why they want hospitals to follow these new guidelines to a T. In Albuquerque, Matt Howerton, KOAT Action 7 News.
Several dozen people who were being monitored for Ebola in Texas are now in the clear. That includes the people who were living with Ebola patient Thomas Duncan when he started showing symptoms of the virus. Sally Kidd has details.
The risk is over for 43 of the 48 people on the original Ebola watch list in Dallas. They were being monitored after having contact with Ebola patient Thomas Eric Duncan, who died at a Texas hospital earlier this month.
They do not have Ebola. They are people who've been through an incredible ordeal, and they are people who need our compassion.
That leaves some 120 people still being monitored for the virus, including some who had contact with nurses Nina Pham and Amber Vinson. Both nurses became infected after caring for Duncan. The CDC is drawing up new safety protocols for healthcare workers who treat Ebola patients.
Much more stringent attention to training, to observation, to making sure that you're well protected.
President Obama, who voted early for midterm candidates in his home state of Illinois, has an open schedule this week to give him flexibility to respond to the crisis. The president's new Ebola czar, Ron Klain, is expected to begin work this week coordinating the government's response, which will include a 30-person quick strike team from the Pentagon.
To help civilian medical authorities where and when they're needed. So they're going to start training here, we hope, within the next week or so.
Reporting from Washington, I'm Sally Kidd.
The World Health Organization has declared Nigeria Ebola-free. More than 40 days have passed since the last possible case there tested negative.